Good morning, America. This is UUSA reporting the Daily Union News. Today is May 22nd, 1864, and today we will be covering the outcome of the Battle of Spotsylvania. Now here is Emily reporting from the field on yesterday's battle. Hello, Emily.
Thank you, Tony. And now for today's battle report. The Battle of Spotsylvania has been a 2-week-long battle in the front of Central Virginia. It started on May 8th and has ended yesterday on May 21st. Our leaders are Lieutenant General Ulysses S. Grant and Major General George G. Meade. The Confederate leader is General Robert E. Lee. The Confederates in this case have the upper hand because we keep attacking them and they just keep defending themselves. But on May 12th and 13th, we captured nearly a division of Lee's army and almost cut the Confederate troops in half. For nearly 20 hours, fighting has continued and might even be called the most ferocious combat of the Civil War. At Harris Farm, we were beaten back by the Confederates with high casualties. We lost 2 generals, Sedgwick and Rice. Also in the fight, Confederate Generals Johnson and Stuart were captured. Generals Daniel and Peril were mortally wounded. In total, we lost about 20,000 soldiers, and the Confederates only lost 12,000 soldiers. Even though we had a lot more casualties, there's no clear winner of the battle. Back to you, Tony.
Thank you, Emily. It doesn't sound like we're doing too well out there. Now here is James with the statistical analysis of the recently ended Battle of Spotsylvania. Hello, James.
Hello, Tony. The Battle of Spotsylvania was more deadly than the average battle around this time. The average amount of casualties is 25,541. The average amount of deaths is 2,980, and the average amount of people injured is 17,058. In this particular battle, there was 27,399 casualties, 4,192 deaths, and 19,651 people injured. There were more casualties, deaths, and injuries in this battle than the average battle. This is not a very good sign, considering most of the people who died were Union soldiers. There are about 2 times as many Union soldiers dead compared to the Confederate soldiers. The Union soldiers lost so many compared to the Confederate soldiers because the Confederate soldiers were camping out in a small town of Spotsylvania. The Union soldiers tried to bull rush the Confederates and therefore lost many soldiers and lost the fight. If the Union soldiers took a little more time to surround the city, then they might have had a better chance to take Spotsylvania. Instead, they were slaughtered once again. Now back to you, Tony.
Thank you, James. Wow, we got slaughtered. Now here is Nurse Ellie with the medical report. Hello, Ellie.
Hello, Tony. Here's the medical report. The soldiers are being cared for by men who are underqualified, understaffed, and undersupplied. All of the physicians are minimally trained. Most doctors learn by being apprentices rather than having a formal education. The men who do go to school train for 2 years or less and have barely any clinical experience or laboratory instructions. Most surgeons are men, but there are also women who volunteer as nurses. Here are some techniques that the doctors have been using. They are giving soldiers who don't feel well something called calomel, which is a mixture of honey, chalk, and mercury. This treatment has led to some cases of tooth loss, digestive problems, and even brain damage. To help ease the pain, surgeons rub morphine into wounds or give it to patients in the form of opium pills. These pills can be addictive, and many soldiers who have returned home are now addicted to opium. Before undergoing surgery, soldiers are given chloroform, a type of anesthetic, when available. During surgery, the surgeons stop the blood flow by using a tourniquet. They then cut through the flesh using a scalpel. To get through the bone, they use a tool called the bone saw. Then to sew up the opening, the North uses silk sutures and the South uses cotton sutures. The operating table is usually a few boards placed between some barrels. One man said this about the circumstances of surgery. Tables about breast high had been erected upon which the screaming victims were having legs and arms cut off. The surgeons and their assistants, stripped to the waist and bespattered with blood, stood around, some holding the poor fellows while others, armed with long, bloody knives and saws, cut and sawed away with frightful rapidity, throwing the mangled limbs on a pile nearby as soon as removed. Most soldiers have been surviving the surgeries, but have gotten infections during or after the surgery. Surgeons are not properly sterilizing their tools, and because there is a lack of water, Many doctors have been going for days without washing their hands or tools, passing germs along to many patients. Many techniques being used are having very bad effects on the soldiers and are causing more harm than help. This is a picture of a bone saw that's used during amputation. And this is a picture of someone being embalmed. Back to you, Tony.